Well, my friends, this is another case of arthritis, osteoarthritis of the gentle lady aged about 66 years, has come from the Kunnagar city of district Hooghly. The left knee joint is swollen, tender, and there is definite some history of ligament of the knee joint, injury of the articularis genu muscle. देखिए दिन एक बार articularis of the genu muscle. Okay. So extension and flexion are the two modes of exercise. Articularis genu, you know the muscles of articularis genu, the only muscle which is inserted into the capsule of the knee joint. You know the muscles of the anterior compartment of the thigh, sartorius, tensor fascia lata, articularis genu, genu means হাঁটু, তো হাঁটুতে গিয়ে শেষ হচ্ছে অ্যান্ড আর্টিকুলেট করে, তাই নাম হয়েছে articularis genu. This is the only muscle which is inserted into the capsular ligament of the knee joint. আদার যে কোনো মাসেল সারা শরীরে বনে অরিজিন হয়, আবার বনেই শেষ হয়। একমাত্র মাসেল যে বনে অরিজিন, শেষ হচ্ছে বনে নয়, ক্যাপসুলার লিগামেন্ট অফ দ্য নি জয়েন্ট। দেখাবো মাসেলটার চরিত্র। Now see from the anatomy book of the articularis genu muscle, a small muscle usually distinct from the vastus intermedius muscle, but occasionally which arise from the anterior surface of the lower part of the shaft of the femur and are attached to the upper part of the synovial membrane of the knee joint, the only muscle which is inserted in the synovial membrane of the knee joint. So the articularis genu muscle is paralyzed, is defect. So there is contractions of the tendons because these muscles inserted into the capsules of the knee joint. At the capsules of the knee joint, and the muscle it becomes lack of support. It gives lack of support, so the collateral ligament are disturbed. So articularis genu muscle is responsible for the extensor of the its main function is to extend. See the function, the quadriceps femoris extend the leg, পাটাকে এরকম তুলতে হেল্প করে, extend. So extend the legs up on the thigh and thigh on the pelvis, উপরে তুলতে সাহায্য করে. So this muscle become paralyzed and this muscle is attached with the capsular ligament of the knee joint, result of which there is difficulty in extension of that knee joint. Now these are called due to osteoarthritis. These are due to osteoporosis. So there are different kinds of arthritis, you know. Some are osteoarthritis, some are known as rheumatoid arthritis, but it is not the rheumatoid arthritis. The rheumatoid arthritis is an autoimmune mechanism. It is due to autoimmune disorder. The synovial membranes and the articular capsules both are affected, but in these joints only the articular capsules are affected. In the rheumatoid arthritis, the synovial membrane swollen and edematous. and the membrane proliferates to fill the joint space, a creeping manner, and often flows freely into the joint, which is known as synovial villi. But in rheumatic arthritis, the normal arthritis, osteoarthritis, the symptoms are different. The term osteoarthritis has replaced the old nomenclature of osteoarthritis. It is rather say degenerative arthritis, because the cartilages are degenerate. The intermediate cartilage between a joint is degenerate, disturbs. Say specimens of the osteoarthritis, the cartilage in this size is totally degenerated. So it is known as degenerative arthritis. So articular genu muscle is become paralyzed and degenerated along with the capsular ligament of the knee joint. So there is symptoms of primary osteoarthrosis. Pain and limitation of the movement of the joint is very much important. There is restricted of the joint. This gentle lady, but in homeopathy we treat the patient, not the disease. So the ligament detached, injured, there are many warts here and there. She is constipated and cannot control the urge of urination. There is fear of dogs. The pain relieved by hot application. All symptoms go in favor of the Hahnemann's greatest antistory, which is prepared from the potash, a kind of potash known as Hahnemann's tinctura sine acris cari. So let's prescribe Hahnemann's tinctura sine acris cari from 1 to 8, 50 millisimal scale of potencies with the direction twice in a day, morning and evening. And I do believe this wonderful medicine will wonderfully cure the gentle lady. Okay?